So CSSD, Central Sterile Supply Department. So it is a service that is responsible for receiving, storing, processing, and distributing and controlling all the professional supplies and equipments, both sterile and non-sterile, for user unit or clinical departments of the hospital for the care and safety of patient under strict quality control. So the main processes that takes place in the CSSD is to receive non-sterile article, okay, process it properly, cleaning, sterilization, disinfection, and all, store it, okay, as and when need arises, distribute it, and control it. Control means if you get receive a broken piece, broken item, it has to be maintenance has to be done for it. Okay, you should have a record of how many items were distributed to which user department. Okay, so that items don't get lost. Whatever goes out from the CSSD should come back to the CSSD. That is the control techniques, okay, and quality control as well. Okay, so these things are done for the care and safety of the patients. Okay, so the main purpose of CSSD is to provide all the required sterile items to the user departments. User departments are the clinical departments, okay, in order to meet the needs of all patient care areas. This is the main purpose of CSSD. So sterile goods cycle, there is a cycle, CSSD cycle, which is same all over the world. Okay, wherever there is a CSSD or TSSD, Theater Sterile Supply Department, that is TSSD or TSSU. Okay, so everywhere, wherever the CSSD is there, the cycle is the same. Okay, so from the department, user department, OP, wards, OT, okay, emergency, all the user departments, they will do decontamination. That is preliminary disinfection. They will do the decontamination. Okay, they will send it to the CSSD where they will receive the logistics. Okay, decontaminated items they will receive in the CSSD. Washing is done. Okay, cleaning is done. And then it will be packaged. After drying, it will be packaged, named properly, labeled properly. Then it undergoes sterilization. Okay, sterilization or high level disinfection, whatever is required based on the clotting classification. Okay, and as and when there is a need, a delivery is done. Okay, and usually user departments, they get a stack of items that they require, and also on top of that, top up is also done whenever there is a need that arises. Okay, top up is also done. Okay, they will issue the logistics. Okay, and this cycle goes on and on. This is a CSSD cycle that takes place everywhere. Wherever CSSD is there, cycle takes place. Okay. Items supplied by the CSSD. Instruments, instrument packs for various procedures, dressing pads, dressing packs, cotton, gauze pieces. Okay, instruments is all the OT instrument, forceps and all. Okay, scalpels, forceps, all surgical instruments, wound dressing instruments. Okay, stitching instruments, wound stitching instruments and all. There are for different procedures, different instrument packs are made. Okay, dressing pads with cotton in the center. Okay, and that gauze piece on both the side, these things are also made and it is sent to the CSSD. There are zones in CSSD. Every CSSD is divided into these three main zones. Okay, soiled zone is the area of the CSSD where you receive the contaminated supply. Okay, or decontaminated supplies also you will get it here itself. Okay, but why we call it contaminated? Because it is not processed yet. Okay, it appears clean, but it has to undergo processing. So contaminated supplies are received here. You have to store them, you have to decontaminate them, and then it is used. Then in the clean zone, inspecting, assembling, and packaging of clean but not sterile supply is done. Okay, technicians are here to inspect if any broken items are there, broken articles are there. Those has to be maintained. Okay, those has to be sent for maintenance. Okay, assembling is done, count is maintained. Okay, different types of kits. Okay, in every kits different types of instruments go. Okay, so assembling is done here, packaging is done, labeling is done. Okay, once packaging is done, the item is ready to be sterilized. Okay, in the sterile zone, this is where autoclaves, hot air ovens, high level disinfecting solutions, these things are kept. Okay, and not everyone will have access here. Okay, there is a limited access here. So these things will be kept here. Then post sterilization, the following steps has to be done. After sterilization, what can you do? Okay. So sterile supplies should not be at any cost. Sterile supplies should not be kept under the sink or places where any places where there is moisture. Okay, these areas you should not store your sterile supplies. Okay, closed and covered cabinets are ideal for it. Open shelves can be used, but it should be a dry area. Okay. Fallen or dropped supplies must be inspected properly for damage. And intact seal is there or not, that has to be checked. So these are the post sterilization steps. Make sure that you don't keep it near wet, moist place. Okay. It should not fall. Collection and distribution of items. At least twice a day, collection and distribution is done. And on top of it, whenever required, collection and distribution is also done. Okay. But on a routine basis, at least twice a day, collection and distribution is done in CSSD. Ensure secure transportation methods to wards. Okay, the trolleys that you use for CSSD transportation should not be used for any other purpose. Okay, it should be secure, means it should not lead to spillage, accidents, breakdown in the middle. Okay, while being transported. So these things has to be avoided. Record each items that you have collected back from the patient care areas, so that you can ensure the control of the supplies. Okay, if anything is lost, anything is missing, okay, a person who is accountable can be found out. Okay, check expiry dates. This has to be done in the wards. When you get the CSSD supply, everything comes with an expiry date. Okay, so on a daily basis, checklist has to be done for expired CSSD items, and it has to be returned to the CSSD if your items have, or if the packs have crossed the expiration date, it has to be returned to the CSSD. Monitoring the sterilization. How will you ensure that the sterilization that you have done is good, it was adequate? How will you ensure that? So we have indicators for that. Okay, you have chemical indicators and microbiological indicators. Okay, so in chemical indicators, of CSSD, different tapes are used. Okay. So they are required when, especially when you are using a steam sterilization method like autoclave. Okay. These chemical indicators, they will monitor the presence or at least attainment of the sterilization process. Okay. It is different colors are also used. There are different types of indicators. Different type of colors are also used. Different types of tapes are also used. This is one of the tape commonly used, just to check if your sterilization process has reached a satisfactory level of sterilization or not. Okay. For example, when placed inside the packs, if you are packing this chemical indicators over the sterile packs, they will confirm if the sterilant achieved a good penetration or not. Okay. They can be used as internal and external indicators also based on what type of load release you are testing. It is important that you just don't rely on chemical indicators. You have to use biological indicators as well. We will discuss microbiological indicators later. And this is a quality control category using chemical indicators. It comes under quality control. So they can capture failures like any equipment, any sterilizer that is not functioning properly. It can also capture if it was the technician's mistake. Okay. These things can be found out. So chemical indicators, they use certain chemicals which can undergo certain physical or chemical change that is very much visible to the human eye after exposure to a sterilant. Okay. For example, you can see here in this tape, before it was cream and white color tape. Okay. But after exposing it to a sterilant, the steam of the autoclave and all to a certain temperature, okay, you can see the color has changed. It has become like this zebra lines, black and white line, and a human eye can visualize this change. Okay, this physical and chemical change that has happened to a indicator, our human eye can see this color change. So it indicates, okay, that sterilization has been achieved. So there are different types of chemical indicators as well. Type 1, type 2. Okay. Um, type 1 is a tape, this indicator tape that you see here. Type 2 is Bowie Dick test. I'll show you the example later. There are at least 6 types of indicators, but you just have to know basic of these two. You should know what is a chemical indicator. That's it. Okay. Different hospitals will use different types of indicators. You have to make sure if as a healthcare facility, if you're purchasing chemical indicators, they should be from a reliable and accessible source. And ISO, also check if they have ISO certification as well. Okay, whichever brand you are using, whichever source you are using, do they have an ISO certification or not? Okay, these parameters you can check. Next is the microbiological surveillance. Microbiological surveillance, here certain bacteria is used. Okay. So here in your textbook, they have given the example of B. Stereothermophilus spore. Okay, this is a bacteria which has a spore. Okay, the spores of this bacteria is used. Okay, so this is also these microorganisms also show if a sterilization process were able to kill a specific number of microorganisms or not. Okay, endospores, bacterial spores. Okay, they are the main, any bacteria which has spores. These are the main type of biological indicators which we use in CSSD. Okay. Geobacillus stereothermophilus is also used, and another type. This is B Stereothermophilus. Thermophilus is also used. Because they are very resistant. Okay, these bacteria are not that easy to kill. Okay, they are quite resistant. And if a sterilizer has achieved to kill the spores of this type of bacteria, okay, it means the sterilization was successful. It was a good sterilization cycle. Okay, even towards hydrogen peroxide, they are quite resistant. Okay, so that's why they are carefully chosen. These microbiological surveillance indicators are very carefully chosen. Okay, depending on the type of sterilization, different types of biological indicators can be used. Okay, certain biological indicators are used only for steam sterilizers. Certain are used for hydrogen peroxide gas sterilizer. Ethylene oxide chamber will have a different type of sterilizer. Okay, a different type of indicator. Okay, so depending on the type of sterilization technique you are using, microbiological surveillance indicators can also change. Different type of bacterial spores can be used. Okay. These indicators, they provide a direct method of the measure of the lethality of the process. How lethal means the ability to kill. Okay, how lethal was the process of sterilization. So if you use these biological indicators to routinely monitor the efficacy of your sterilizers, that's a quality control measure. Okay. And if when will you say the the sterilizer has a passing result? It is when the sterilizer is effectively killing a large number of highly resistant bacterial spores. Okay, when your autoclave procedure, ethylene oxide chamber, hydrogen peroxide gas, it is able to kill resistant bacterial spores. That's when you can say this is a quality assured sterilization technique, right? So that's the importance of using these biological indicators. So here you can see on the image, okay, this is a B Stereothermophilus spore before placing it into a autoclave. Okay, this is how it looks. It's in violet color. Okay, light purple, light violet color. After sterilization has been done, when you remove this vial, you will see if the color has completely turned into this yellow orangish color, it means you have attained a good sterilization. Complete change in color means all the bacterial spores have been killed. Maximum lethal effect was shown by the sterilizer. Okay, all the bacterial spores were killed. That's why the color completely changed. So whatever you have sterilized in this cycle is safe to use for the patients. But when will you say the test is negative? When you see there is not much change in the color. The color is still same and some cloudiness is there. Some clumping of proteins and cloudiness is seen. But the color has not changed much. So the bacterial spores are still intact. There is not much change to the bacterial spores. The sterilization cycle has not achieved complete sterilization. The instruments also along with it is not safe to use. Okay. So this is the importance of microbiological surveillance. So when you use both chemical indicator and biological indicator, when you use both of them together, that's the best way to move forward. Don't just depend on one thing. Okay. If you're using both, it is much better. Is it clear to all? Next is the guidelines for steam sterilizers. Okay. You have the device preparation, in which before you start your sterilization cycle, you have to just see if the device is working properly. Okay. There is no short circuit or anything like that. Okay. You have prepared the device well. There is no breakdown in the device. Okay. These things has to be checked. In detail, they have mentioned uh, in the textbook. Different types of device will have different types of preparation. Okay, hot air oven, autoclave, ethylene gas chambers, okay, hydrogen gas chambers, pyrolysis chambers. They all will have a different type of preparations. You have to also make sure that your sterilizer is meeting all the standards. Okay, physical structure of the sterilizer should be solid, high quality, stainless steel, or whatever is the material of the sterilizer. Okay, they should be of good quality. Proper electricity supply is there. There is no chance of short circuit and all. Okay, these things will come under device preparation. Packaging, the way how you pack the items. Okay, packaging will have a lot of labeling required. Okay, the proper way of labeling. Who was responsible? Which technician is responsible for the labeling? uh, what was the autoclave cycle or sterilization cycle. Okay, number of articles, name of all the articles inside this package, name of the kit, okay, expiration date, all these things has to be mentioned in the packaging. Then unloading, do not open any autoclaves or hot air oven when the temperature is still high. You have to allow the load to cool down, okay, and then open it. Then open the chamber. Otherwise, it will damage. The sudden gush of cold air will damage the items which are kept inside. Okay. Troubleshooting of like wet pack problems are there, in which a pool of water will be trapped inside the packages, so that you cannot use. Okay, so when you have a lot of wet pack problem, it means your sterilization has to undergo maintenance. Okay, when you are autoclaving something, and in autoclave steam is used. Okay, steam, once it gets uh, into a cold temperature, it will condense and it will form pools of water. But if you find these pools of water inside the sterile pack, okay, it is trapped inside the sterile pack. That's what we call as wet pack problems. Okay, so these in these situations, troubleshooting has to be done. You have to shut down the device for a while, get the maintenance done, and then see how it functions later on. When you're doing flash sterilization, okay, for example, flash sterilization, immediately you require certain sterile articles. You can't wait for 1 hour or 30 minutes, okay, for the sterilization to complete, load to cool down, then open the autoclave and then use the article. It will take around 1 hour. You don't have that much of time. In some emergency situation, immediately you require certain sterilized articles. So you go for flash sterilization. Flash sterilization will hardly take 5 to 10 minutes. Okay. But whatever articles have undergone flash sterilization, it cannot be stored. It has to be immediately used. Okay. Articles that have undergone regular sterilization, they can be stored for a specific period of time. They have an expiry date. After that, it cannot be used. But flash sterile articles are used immediately, soon after the sterilization. You cannot store them, okay, like regularly sterilized articles. Quality assurance procedures, every different type of sterilization has a different type of quality control and quality assurance, okay, that has to be followed. There is a quality in charge, infection control officer or a quality control officer in charge will be there. Okay. They are responsible for the training. They are responsible for the lockdowns. Okay. Keeping the documents and records and reports handy. Recall procedure. Recall procedures are done when you see that items have been sent to the departments for use, but later you understand that the sterilization was not achieved completely. Okay, like later you saw the microbiological surveillance report or the chemical indicator. Okay, but before that, the items were dispatched to the user department. If that kind of errors take place, recall procedure is followed, in which the CSSD head, the in charge of CSSD, will call the nursing superintendent and inform that the sterile items on this and this date, which was sterilized with an expiration date of so and so. Sterilization cycle number is also mentioned in that phone call. Okay, these items has to be recalled back to the CSSD because sterilization procedure was not efficient. The nursing superintendent will send this message out to all the staff nurse in charges. Okay, the staff nurse in charges of different wards will go through their sterile packs. They will find out the sterilization cycle of particular date and they will send it back to the CSSD. Okay. And if there is any broken items or broken instruments, you have to send it for maintenance. You have to repair it, then do the sterilization, and then it should be sent to the user departments for use. Okay. So these are the basic guidelines. Then you have the Bowidic indicator. This is the Bowidic indicator, another form of chemical indicator. Okay. So the yellow and white stripes will convert into black and white stripes if the sterilization was done adequately. Efficient and adequate sterilization was completed means yellow and white will turn into black and white. Okay, this is pass, sterilization pass. Okay, but if it is still yellow patches are there here and there on the Bowidic tape, it means it has failed the sterilization. Articles of this sterilization cycle is not fit for use. Okay, so that's the Bowidic indicator. So is it clear to all? If you have any queries, you can mention in the chat.